Hi everyone. Today we have got someone special with us again. We have Dr. Soumya with us. She has got a rank 4 in the CS in NEET-SS Medical Oncology group. Welcome, Dr. Soumya, and a huge congrats to begin with.
Thank you so much, sir. Thank you so much. Good evening, all.
Yeah. So again, I'll go with the cliche question first. How does it feel? I'm pretty sure you were prepared, you were confident, but I think a top 10 special within the first 10 ranks is always special. So how does it feel?
So I'm very happy, obviously very happy, and the feeling is slowly sinking in. At first, I was not able to believe that my rank would be within the top 10 ranks, but yes, I'm happy.
I'm sure you would have visualized at some point being in the top 10 or I mean,
Yes, sir, obviously.
unless you
A
conceive
single
it.
digit, yes, sir, a single digit rank was a dream that has
Great,
come true.
great. I think unless you dream of it, I think you will never reach there by chance. I think you would have definitely dreamed of a top 10. Great to hear that. So before we go on, can you tell us about yourself? Where are you from, your educational background and all that?
Yes, sure, sir. I'm Dr. Soumya Singh, sir. I have done my MBBS from MP Shah Medical College, Jamnagar, and
Mhm.
I've done my post graduation in general medicine from BJ Medical College, Ahmedabad, and I'm currently in Gandhinagar, Gujarat, sir.
You're from Gujarat.
Yes, sir.
Okay. So you are from a general medicine background, is it?
Yes, sir.
Okay. So how was it, now the current pattern of purely focusing on oncology? We are not exposed to much of oncology in our general medicine days. When I'm from an MD medicine background, and uh, I know it can be tough making the switch from general medicine to med onc. So, how did you bridge that gap when compared to, say, someone from a radiation oncology background? Was it any tougher? How did you go about it?
So, honestly speaking, till my university examinations, I was pretty sure that I do not want to go for any super specialty program, and I want to stay as MD General Medicine only because I love this subject, truly love this subject. But then, living in a tertiary care city, and I wanted to go ahead eventually with a super specialty program, but at the same time, I was not. Able to restrict myself to a single domain of internal medicine, like to go for a single system. So,
Mhm.
in that aspect, medical oncology proved a
I get
good
it.
option
I
for
have
me.
similar reasons too, so I get what you say. I think you see everything from head to foot. I mean, a cardiologist
Yes, sir.
sees pretty much only the heart. Yeah,
Yes, sir.
that's great. But my question really was, you don't have, I mean, you do not see a CA breast in your residency. We do not manage CA lung in our residency. Most of us don't. We don't do anything with gynec oncology. So,
Yes.
how do you think you had to put in some extra effort towards those areas of the preparation? And how did you go about it? What was your modus operandi?
Obviously, sir, I had given my previous NEET as well, but I prepared for that just 1 month prior to. So after the exam, I realized that I was lacking in my practice of questions in theory, everything. So I made my notes from Marrow, read that again and again, highlighted the points which I usually used to forget, and then I used to practice the question bank religiously and gave the GTs and the mini tests, and
Okay.
also made a diary of the topics which I made repeatedly wrong. So, and read it just the previous night before the exam
Okay.
for the
Oh, that's
volatile
great.
topics. So,
That's great. That's great. So I think a lot of people always ask me, lot of people who want to take up medical onco after general medicine for similar reasons. I told you I had very similar reasons. I think I wanted to take up nephrology during my MD general medicine days, but then I kind of thought I cannot restrict myself to a single thing. I had the very same reasons. Then I thought of medical onco and gotten. So I think it's a recurring theme. Every year we do interviews with people who come from the medicine background. I hear the same stories, and again with this changing pattern in need, a lot of people, a lot of students, friends, people who know whom I meet, everyone asks me, is it becoming tougher and tougher for general medicine aspirants to get into medical onco? But I think you finishing in the top 10 without maybe working in an oncology department per se. I think that's quite
Yes, sir.
inspirational. It shows that with focused hard work, you can crack it. It's not rocket science. So great to hear that. I think it will inspire a lot of people. So can you tell me? So I guess you dropped 1 year and focused exclusively for medical oncology. That's what I understand. So you went
So
through Marrow.
actually, I
Yeah.
had my I had my bond duties in rural service for 1 year.
Okay. Okay.
So I
Okay.
joined that duty and was preparing in evenings and took 1 month
Oh,
leave
nice.
just before the exam. Yes, sir.
Oh, so the predominant part you were still working even as you were preparing.
Yes, sir. Yes, sir. Just one
Oh,
month back, I took leave from my duties and prepared 100% to that exam. Yes.
okay, great. So you told me you were relying on the Marrow notes and question bank and all of it. Did you
Yes.
refer any standard textbooks for the
No,
when
sir.
you go through? Go
For
ahead. Yeah.
systemic oncology, I majorly relied on Marrow, and for some general oncology part, I refer to Harrison, sir. The general
Okay.
oncology in Harrison's is quite good, I feel,
Mhm.
and the hemat part is also good there. But for systemic
Mhm.
oncology, I totally relied on Marrow notes only. And
Okay.
after solving the question banks, there were some topics which were not covered in the notes, so I jotted down the points. The
Mhm.
explanation was given below the questions, so I added those in my notes only.
Okay. Okay. So you have not, other than Harrison, you have not gotten into any of the uh, say textbooks like Davita. You had not referred to any of them, right?
I had started reading that, but after finishing some general oncology chapters from that and then solving the questions, I felt that Marrow notes and the general oncology part from Harrison should suffice with
Absolutely.
practice of questions.
Absolutely, absolutely. And that this is again something I've always been. I think chasing too many things, trying to learn. Oncology is too vast. I mean, even after you finish
Yes.
DM, there will be a lot of things you wouldn't still know. I mean, even in our practice, uh, every day we have to look up the latest guidelines. You have to still read up. I think if we see a new patient today and we might still have doubts, I still come back and read to treat the patient tomorrow. So I think trying to know the whole thing is never really possible. I think you should be smart enough to decide your source, uh, stick to it. Of course, you can refer multiple sources, but I think it should all be doable. That's what I always tell.
Yes, sir.
Rather
Exactly.
than trying to get the whole thing, the game plan should always be quite simple. Yeah.
Yes.
So kudos for sticking to that. What else do you want to tell the people who are preparing like this? There's a lot of pressure. How do you handle the mental aspect of it? How did you keep yourself sane? I mean, there must always be pressure, right? There's an
Yes,
year,
sir.
yeah. So how did you handle that? What were your ways of
The
keeping yourself
pressure was
calm?
obviously there, sir. In the first NEET, I secured a rank of 226,
Hmm.
and but then I thought that I have obviously a bond year of duty to do. So I
Hmm.
thought I can improve my rank and get to my dream institute, that is TMH Mumbai.
You would have gotten a good seat in last year, right? 226 is a
Yes,
good
sir.
rank.
Yes, sir.
Oh, that's quite brave. Oh, go ahead. Go ahead, please.
Yes, sir. So, but after giving the exam and seeing such questions, I was really scared. Was it a gamble back then? But
It was
eventually,
a gamble, I tell you. It
yes, sir.
was a gamble that paid off. But
Yes,
yeah,
sir.
I mean, I have people who ask me, I have 200, 250, should I take? I always tell take. I never tell
Yes, sir.
drop any year.
Yes, sir.
Uh, it was a gamble, but for you, I think it's really paid off handsomely. And I think that would have added the pressure, right?
Yes,
That
sir.
the fact that
Definitely.
you're
The
probably
pressure.
wrong.
Yes, I was fighting for those limited seats in TMH, so the pressure was immense. But
Mhm.
I always thought that limiting the theory part so that you can frequently revise it. Frequent revision is more important than reading a vast amount of theory, I guess. So I was limited in the theory I was going to read. If I found some new topics after solving some questions, and the topic would recur in questions, then only I would jot down the points in my notes and highlighted
Mhm.
it that I need to read about it. And also the last videos that you uploaded, sir, about rectal carcinoma. So TNT question was there in the exams. And
Mhm.
you also posted a long videos about the immunotherapy drugs and the latest updates. few
Yeah.
questions from us from that also. So
Mhm.
that really proved helpful. And the question bank in Marrow is very good. It is subdivided with subtopics so that you can read it and then solve the questions, and then you can go back to the theory and assess where you were lacking, or you have just read a line, and being from a medical oncology, I may not be getting the true essence of that line, but after solving some clinical oriented questions, I was able to get, yes, that line meant this. And then the theory part became strong. So
Great.
retrospective evaluation is good, sir. After solving the questions, you can go back to theory and then realize what importance does that theory hold for
Good.
that
So
topic.
you basically completed the whole topics once in the initial few months, is what I understand. And
Yes,
then
sir.
you kept going back, you kept testing yourself in question banks.
Yes, sir.
What you were not sure of, you kept going back and then updating it. I was trying to post some recent updates. You went through that also. So
Yes, sir.
that's it. Okay. Okay. And that's important again. I think people should finish the whole thing initially so that they can keep coming back. Think some people
Yes,
do
sir.
a mistake, especially people who take 1 or 2 years off. I think they try to go in depth, and by the time they finish the whole topic, what they studied in the beginning, they are not so fresh about it. I think it's important to have finish the topics first, then keep going back, and that's an excellent strategy. That's what I always tell
Yes, sir.
people. Did you go
Yes, sir.
through some online things like NCCN guidelines or up to date? I mean, they are all part of our notes, but were there any point where you refer to them exclusively?
For some topics, like for breast cancer, for lung cancers, I went, but other than that, not much, sir.
Not much.
Because
Okay.
the topics were hugely volatile and I was not having any practical knowledge. So there was this limit so that I can get those points. So I preferred restricting to the theory of Marrow only, and just
Mhm.
solving repeatedly questions and going
Okay.
back to the theory and revising it. The frequency
Really
cycle was very short. I frequently used to revise the theory part and doing questions.
great, great, great. I mean, I think this is quite similar to how I study too. I mean, when in my studying days, I always had I think even now when I have to make a PPT, I usually get the whole thing done and then I keep revisiting. I think it always works
Yes,
for me too.
that
I'm not
helps. Yes,
someone who
sir.
can, I think it's got to do with some short attention spans. I can't sit on a one
Yes,
thing for a long time, maybe.
yes. Same for me.
Yeah. Yeah. So you didn't answer. How did you manage the pressure other than the academic stuff? What
There
were
was
your
one huge inspiration for me, sir. My husband is a surgical oncology resident in TMH only. He
great?
secured a rank of 61 last year, so he was
There was
quite
in-house.
motivating for me. Yes, sir.
I'm sure he was not available for much of the last year, being a first year resident in TMH.
Yes, sir. But he used to call and he used to tell me कि, when you will enter this field, you will realize how pious this feels
Absolutely.
to help these patients who have just lost faith in everything, and you will just love entering this field of oncology, and that used to inspire me a lot, sir.
Absolutely. I mean, I think when you are seeing a patient who has just been diagnosed with malignancy, I mean, that's the most defining moment of their lives. I don't
Yes,
think
sir.
there is any other diagnosis that gives them. So you tell a patient he has coronary artery disease. It doesn't feel that life defining. For them,
Yes, sir.
all the life they have lived come to that point when they know they have cancer, and there's a lot of uncertainty ahead.
Yes, sir.
It's deeply humbling, I would say, every day going to the clinic, finishing your OPD, breaking the news. It can be emotionally overwhelming. But I
Yes, sir.
think we going through this very heavy examination process is also a test of our resilience. So only these resilient people can take this forward, is what I always feel. And I think that's the right reason to get into medical oncology. Again, congrats on that. And I love the way you have approached the preparation. Uh, and people from general medicine background breaking the odds, and clearing this is always inspirational for people from those backgrounds. I think I always feel this people from both backgrounds have got their own pros and cons. People who finish a radiation and come in, they do have their own advantages. People who finish medonc and come, general medicine and come, they have their own sets of advantages. Probably after 3 years of training, it depends upon how you do the training properly, is what I always feel. So
Yes,
great
sir.
listening to your story. It's really inspirational. A lot of things will prove useful for a lot of students who are aspiring. And see you soon. I think we are still quite a small community. Hope to see you at some conferences going forward.
Thank you so much, sir. Thank you so
Thank
much.
you. Nice having you. Thank you so much.